Causes of rising costs, let's not get into all that, you know what that is. Government paperwork, new technology, high insurance company profits, malpractice, fraud, and so on. This is the cartoon that says, this is a healthy profits insurance company. Are you crazy? A government healthcare system would be a bureaucratic nightmare, and that's the owner of the company, and you can see the bureaucratic nightmare of all these little computers saying no, no, no. That's obviously a cartoon by someone who is critical of the health industry, and I apologize to those of you who are in that industry. We have an aging population. I have already told you that, and you looked in the mirror this morning and realized that anyway. And so here's what we've got. You know, we are at 2010, 40.2% of people in the US 65 or over. Shift over to the last bar chart in 2030, and we're going to have large numbers. And that's, that's 40.2 million, and it'll be 72.1 million over 65 in 2030. And this is the chart that shows you as you get older, as the age increases, how much healthcare, per capita healthcare spending increases. You can see those of you who are 75 or over there at the very end are costing a lot of money to yourselves and to the rest of society. Aging just simply costs a lot of money. We have obesity, and we have very bad problems in the United States with healthy food and healthy habits, exercise, and so on. And these are some of my favorite pictures that I use in my American government class, because immediately you see the students put away their chocolate bars and put the caps on their pop and so on. 2009 poll, 72% of Americans are worried that if someone in their family becomes seriously ill, their health insurance may not cover the medical bills. 47% is very worried about inadequate health care coverage. 65% worry that if they lose or change their job, they might lose their health insurance. 60% say they worry that if someone in their family becomes seriously ill, their health insurance might drop the coverage. 56% worry that if they lose or change jobs, they may not be able to afford health insurance. Those are important polls. This is a poll from Nevada just from this last week. 34% support the current Senate bill. 32% of independents support the current Senate bill, which is not current anymore, really. 58% support a public option. 61% of independents support a public option in Nevada. And 55% support reconciliation on health care, and 64% of independents support reconciliation. I know, politicians, they always talk in their own little language. Why don't they just use normal words? What's reconciliation, Well, reconciliation is that instead of passing a whole bill, you go, well, we're just going to take all these little pieces and vote on them. You don't have to have 60 votes in the Senate to stop a filibuster, because with reconciliation, you can pass all kinds of little pieces as long as you have a majority. I think, I'll be honest with you, I think President Obama is going to grab the Democrats, smack them across the head, and say, start passing reconciliation health reform now. And the Democrats, until 2010, are going to have a majority in the House and Senate to pass all kinds of legislation at the federal level. After 2010, when the Republicans take over the House and Senate, then the Republicans will have to figure out how to do health. Oh, did I say that? I'm sorry. My D friends don't like me to say that, but I have a crystal ball, so that's why I'm called Dr. Politics. Confusion, look at this. Americans began favoring health reform. You see the black line, and very few of them opposed it. More and more opposed it as they saw the process happening. Fewer and fewer supported, so that now 51% oppose the health care plan as if there were one. And one reason is that there has been so much confusion, and also media hype, death panels, Obamacare, big government, all kinds of discussions, and real risks that Medicare and other programs are going to be tampered with. So there has been a change, even though the other polls show that Americans would like something done about healthcare reform. You know about the rising costs in Iowa and other places. Did you know that there is an alternative cost containment method for healthcare? Yes, there is. This is from my latest issue of I guess Business Week. It's not called Bloomberg's Business Week. The private sector solution to healthcare reform, if nothing else happens, is that the big lizards go out and eat up all the little lizards. The big companies go and buy up and swallow and incorporate all the little insurance companies. Why would that be a cost reduction and contain management strategy? Because by eating up all the little companies, you spread your risk and you essentially end up with a larger business model from which you can then work, and it would allow companies to regulate the delivery of healthcare and essentially deal with it. It's a big business, $2.5 trillion in 2009 U.S. healthcare spending. I saw the figures for Iowa, and you folks really contribute to the economy of the state, a lot of jobs, a lot of wonderful services, and if we don't do something, there will be a lot of large companies buying up little companies. So I think I was at the State House last week. Was this last week? Anybody remember? Do you know what this was? Anybody? Who was there at this?
I think it was SEIU's.
And nobody here was there? Wow, interesting. Well, there are lots of people at the State House, I tell you, and they're there pushing for health care discussions and other things. And as I said, it is a scary process, and it is incomprehensible to a lot of people. And I guess I would end by simply saying that I think Kirk Norris already said this in a different way, that you are the very best messengers, both to the legislature and to the public, to help clarify and also to help to dispel some of the confusion that exists. You are, because you understand it. So when you leave here, I'm 5 minutes over, I'm done. You will get on the buses, I think, and go there, and you really know what you're talking about. And the legislature needs to hear from people like you, but also talk to the media. Go find some Des Moines Register reporter, go find somebody who's got a big, huge, not one of those little video camcorders like Stan Brewer has. By the way, we're gonna have a little bit of this on InsiderIowa.com, on our magazine, a little bit of my talk. So if you were asleep because of the heavy dessert, you can go there and watch part of it again. I think there was a heavy dessert. I didn't get any, but there was no dessert. Oh, cheap organization. All right. I think you are the very best messengers to the legislature, and they want to know, and the media wants to know, and the public wants to know. So please go there and explain to them how this works, why we have to do some interesting new things. And your organization, of course, is fantastic, and I congratulate you for all your work. And you are providing the answers that are not coming from Washington, D.C., and that is why not only are we e pluribus unum, but as a federal system, we have the wonderful opportunity to not wait for Washington to do things. We are a country where we can solve problems at all kinds of different levels, and this is a very big one, and let's start solving it at this level. Thank you very much. I appreciate it.